Sun exposure is essential for our bodies to synthesize vitamin D, a crucial nutrient for bone health and immune function. However, prolonged sun exposure poses serious health risks, including sunburn, skin cancer, and premature aging. For fair-skinned individuals, exposing arms, legs, or face to sunlight for 10 minutes several times per week is generally sufficient to synthesize enough vitamin D. In contrast, darker-skinned individuals require more time because their skin contains more melanin, which provides protection against UV radiation. UV radiation poses significant health risks, including sunburn as an immediate effect. The likelihood of sunburn depends on the UV index and geography, with fair-skinned individuals getting sunburned in as little as 10 to 15 minutes of midday sun exposure, while darker-skinned individuals may take longer. Symptoms of sunburn include redness of the skin, pain, tenderness, swelling, and blistering in severe cases. The affected skin feels warm to the touch. In several days, sunburned skin will peel and become itchy as it heals. Treatment includes applying a cold, damp cloth or taking a cool bath. Aloe vera, calendula cream, chamomile lotion, or sunflower oil can be used as moisturizing lotions. Avoid alcohol-containing products, as they can dry and further irritate the skin. Drink water to prevent dehydration. For pain relief, ibuprofen is effective, and it is important to avoid further sun exposure. A more significant long-term risk of sun exposure is skin cancer, particularly basal cell carcinoma, squamous cell carcinoma, and melanoma due to DNA damage from UV radiation, which causes mutations. Even small amounts of regular sun exposure can increase the risk of skin cancer. A history of sunburns, especially during childhood, dramatically increases this risk. Basal cell carcinoma, the most common type, often appears as a waxy bump, while melanoma, the most dangerous form, can develop in an existing mole or appear as a new dark spot on the skin. The risk from UV light is substantial. For example, using tanning beds before the age of 35 increases the risk of melanoma by 75%. This risk is especially high in people with fair skin and those with a family history of skin cancer. Sun exposure also causes skin aging because ultraviolet rays break down collagen, the main protein responsible for skin elasticity. Additionally, sun exposure increases the risk of skin damage called actinic keratosis, which manifests as rough, scaly patches that can be precancerous. The sun also causes hyperpigmentation, persistent dark spots, and uneven skin tone due to increased melanin production. Moreover, sun exposure weakens the immune response and decreases the skin's ability to repair, increasing the risk of skin infections. Eye exposure to the sun can cause photokeratitis, which is a sunburn of the cornea, leading to pain and temporary vision loss. Prolonged exposure to UV rays can also lead to cataracts, pterygium, growth on the eye, and macular degeneration, all of which can permanently impair vision. Heat stroke is another severe condition caused by prolonged exposure to high temperatures, often combined with dehydration, leading to the body's inability to regulate its temperature. Conditions leading to heat stroke. Duration. Heat stroke can occur within 30 minutes to several hours of intense sun exposure, especially during high temperatures and high humidity. Risk factors: physical exertion in hot weather, lack of hydration, wearing heavy clothing, and lack of acclimatization to heat. Treatment of heat stroke. Move the person to a cool place and use cool water or ice packs, particularly on the neck, armpits, and groin. Give the person cool water to drink if they are conscious. Heat stroke requires emergency treatment as it is a critical condition. Some skin conditions improve with sun exposure, such as eczema and psoriasis. Sunlight can help reduce the symptoms of psoriasis by slowing down the growth of affected skin cells, and some people find that their eczema symptoms improve with moderate sun exposure. However, conditions like rosacea, lupus, and vitiligo worsen with sun exposure. Preventing harmful effects of sun exposure. Use broad-spectrum sunscreen with an SPF of 30 or higher, and reapply every 2 hours, especially after swimming, sweating, or towel drying. Wear protective clothing, such as hats, sunglasses, and long-sleeved clothing. Seek shade, especially between 10 a.m. and 4 p.m. when the sun's rays are strongest. Avoid tanning beds as they emit harmful UV radiation similar to the sun. Check for dermatological consultation if you notice new or changing moles and spots.